All right, it's wonderful to have you all here and welcome to our fourth episode of Data Talks, a series of free 45-minute webinars about using local data to inform housing policy. My name is Claudia Aiken. I'm Director of New Research Partnerships here at the Housing Solutions Lab. This episode is a special collaboration with Community Solutions, and I'm delighted to introduce Adam Ruege, Director of Strategy and Evaluation, who will be speaking with us about homelessness data, and specifically Community Solutions' approach to helping localities build real-time homelessness data systems. And I'm also just delighted to welcome our guests, Mackenzie Kelly and Jodie Legg of the Chattanooga Regional Homeless Coalition. In part through the power of real-time person-specific data, CRHC helped lead Greater Chattanooga to functional zero, and you'll learn more about what that means, for veteran homelessness in October of 2019, and made more progress since then. And we just can't wait to ask them about their experience. So I will start off with a very brief introduction to the lab and to this series. I'll then turn it over to Adam to lead us in a short presentation about the Built for Zero data model and how communities are using it. Then we'll have that conversation with Mackenzie and Jodie about Chattanooga's experience. And finally, we will have about 15 minutes for your questions. So please feel free to submit those via the Q&A function at any time during the session, and we'll get to as many of them as we can. And you'll also be able to see videos of all these webinars along with some recommended reading on our website. I'll drop the link into the chat shortly so you can see where that is. If you're not familiar with the lab, we're based at the NYU Furman Center. Our mission is to help small and mid-sized cities plan, launch, and evaluate evidence-based housing policy with the goal of advancing racial equity, health, and well-being. Thank you so much for joining us today. I hope you will also join us for some upcoming episodes, including one in June on housing conditions data and another in August on storytelling with local data. Each of these will feature a fireside chat with someone like Mackenzie or Jodie, and we will let you know when these episodes and registration for them is live. We are already thinking about new webinar topics for the fall, so if you have ideas or any questions at all, don't hesitate to reach out. And now, without further ado, I'm going to turn it over to Adam.
Great. Thanks so much, Claudia. My name is Adam Ruege. I'm Director of Strategy and Evaluation here at Community Solutions. I support a number of efforts within the organization and supporting our Built for Zero movement. We'll go into detail about what that is. I've worked in the homeless sector for just about 20 years, mostly in the federal sector in the last few years at Community Solutions, a nonprofit, and I'm based out of Columbus, Ohio. So really, just want to express deep appreciation for the Furman Center inviting us, and also Mackenzie and Jodie, who represent a community that works with us through Built for Zero. So really want to excited to have a fireside chat with them about the work that they're doing there. Next slide. So a little bit about Built for Zero. Built for Zero is a movement of over 100 communities across the United States, and a movement of over 80 communities internationally, in supporting and developing what we call the Built for Zero model. The model is really based on understanding how the current systems work and optimizing those systems, or seeing homelessness as something that is a system level problem that requires system level solutions. So, since 2016, there's been over 100 communities that have been working with us. 14 communities have achieved functional zero for at least a population. A number of communities also seen major reductions in homelessness in their communities. Next slide, please. So there's four components to what we call the Built for Zero model. And this is what we do with communities. We either provide direct service, direct support to those communities and coach them to adopting the model, or we do it through states or maybe other nonprofit organizations. This is what we call partner-led. And there's four components of the model that we've learned to be effective approaches to see reductions in homelessness. One is really having an integrated command team, right? Somebody or a team that's accountable throughout the whole community to see reductions, to drive reductions in homelessness. Second is this idea of community level measurement, to actually have a goal, to actually define what an end state or a milestone would look like. That's why we talk about functional zero, this idea that homelessness is rare and brief. It's difficult to understand what you are trying to achieve if you don't have a measurable, easily understandable goal. So we work with communities on defining what functional zero is for the community and work towards that. Third is this idea of comprehensive real-time by name data, which is going to be the focus of this presentation. And then fourth is this idea of based on having evidence and system level approach, investing in what works, using real-time data to invest in what works, whether it be housing or treatment, whatever the case may be in communities. Next slide, please. So, just real briefly, when we talk about the data work, we believe, and again, we've been doing this for about 10 years now as an organization, we believe that the systems can really be transformed, and that regardless of the size, and we work with communities from, smallest communities in rural Appalachia, Virginia, to some of the largest communities in the West Coast. And one thing we've learned is that communities are not that dissimilar, and that oftentimes the challenges that smaller communities, while they may not have the same size and scale as larger communities have, some of the fundamental issues are the same. And so what we believe, or at least when it comes to data and technology, is that, that the systems can be transformed. It doesn't require completely dismantling them. And that's been proven by the Built for Zero work. And you're going to hear a little bit from Chattanooga here in a little bit about how they've transformed the system. It didn't require complete uprooting of that system. Next slide, please. So just, it all starts with this idea of by name data, and it's actually very simple. This idea that a community can say and have confidence in the number of people experiencing homelessness at any given time, the reasons why they're homeless, and the reasons why they're exiting homelessness, right? And what we've learned is that when communities actually know this, and they're actually they know by name that these individuals experiencing homelessness, they see better outcomes. We have a third-party evaluator who is following us over the next 3 years that's supporting us in understanding what's working. And what is starting to emerge is that when you develop a by name list methodology, when you actually can track and identify how many people are experiencing homelessness and who they are, they see better outcomes. They see less length of time homeless, or they see higher housing rates. And so it all starts with this by name list. And the other thing I want to just state is that there's privacy, there's privacy controls, there's security controls as well. And especially if somebody doesn't want to be identified, there's no requirement to receive services by a local community if they don't identify themselves. So there's protections in place. Next slide, please. So communities in Built for Zero, we work with them to be able to pull data, very basic metrics, the number of actively homeless individuals, in their community, their inflow, or people coming in, and their outflow, people going out. So it's very simple. It's a very simple methodology that we use, and most communities that we work with actually use HMIS, the Homeless Management Information System, to be able to track this data. Some use other systems, but HMIS is typically the one we work with. And what we've learned is that HMIS can actually do this in communities if it's configured correctly. So what we do is we work with communities to identify these 3 key metrics so they can understand on a real-time basis how many people are experiencing homelessness, why they're coming in, and why they're leaving. Next slide, please. There's 4 key elements of what we call quality data, by name data. One is that it's comprehensive. It requires all agencies and programs supporting people experiencing homelessness in their community to be using and sharing data in a single place. We know that's challenging, and that can take a long time to bring people to the table too. But we've seen it time and time again, it works. And people are willing to come to the table. Second, it's person specific. That's what I was referring to in some of the stuff I was sharing around by name data. Third, it's regularly updated. So the list is updated on a regular basis. Monthly at a minimum. What we know is that many communities actually do it on an almost daily basis to be able to track in real time what's happening in their system. And then it also has quantitative reliability. It's like balancing your checkbook, right? So there's measures in place to be able to identify if the list is reliable or not. So those are the four key elements of quality data. Next slide. And we actually work with, over 130 communities to assess their readiness for this idea that they have really strong binding data systems. First one is having effective outreach systems, and outreach being, those experiencing unsheltered homelessness. Is it coordinated? Are you able to identify where the encampments are, who they are, who's living in those encampments, so that you have a good sense in a community of who's experiencing unsheltered homelessness. In addition to, the shelter providers, transitional housing providers, those other providers that are serving homeless individuals and families, they're also reporting data in the system. That's why we talk about provider participation. We also assess and work with communities on developing policies and procedures so that it's sustained and everybody has clear understanding of how it operates. And then fourth is this data infrastructure that the system is developed so that these metrics can be tracked and that they have a sustainable data infrastructure. So again, we work with over 130 communities in varying levels of development, but what we see pretty consistently, regardless of the size or the region of where the community is, these things are achievable. Next slide, please. Since 2016, over 70 communities in the U.S. have achieved this quality data standard, meaning that they have confidence in the number that they have confidence they can say how many people are experiencing homelessness. These are typically at the subpopulation level, so starting with veterans or chronically homeless. But over the last year, we've seen a number of communities actually focus on all single adults, youth, and families, so that they actually can see at a whole system level how many people are experiencing homelessness. So over 70 communities admit the standard of what we call quality data, that they have confidence in the number of people, they report on the number of people experiencing homelessness, that 14 communities have achieved this functional zero. So think of quality data as being a foundational milestone. That's how you're never going to be able to solve the problem if you don't know the scope and the scale. And that's where that actively homeless number, that finding data comes from. 14 communities, including Chattanooga, has reached this functional zero milestone. Next slide, please. I just want to speak real briefly. Like I mentioned, we have a third-party evaluator that's evaluating the work that we do in Built for Zero to understand the model, see what's working. We're actually seeing some emerging outcomes that we're seeing in key improvements and how systems are working together and reductions and getting people into housing more quickly. And in this deck is a write-up that was developed last year on some of those improvements. So I just wanted to highlight that. Next slide. Most importantly, though, you want to talk about the concrete, like going from the conceptual, this sounds like a good idea, to actually how communities are using the data. So I'm sharing that this is a real life example of a city that is in Built for Zero that has been actually looking at the number of veterans experiencing homelessness since 2017. And on a almost daily basis, they can actually identify how many veterans are experiencing homelessness, how many are coming in, how many are leaving. And it is, for the last 5 years, they can actually report out on a monthly basis those numbers. I had the opportunity to sit down with this community a few months ago, and around the table, you had the local VA, you had the mayor's office, you had the public housing authority, you had, other nonprofit service providers around the table looking at the data and solving problems on the spot, right? To be able to figure out why is inflow increasing or why is outflow decreasing. And they have insights in making decisions on the spot. It's really incredible. And that's what the power of the data can do, right? It removes, it doesn't become theoretical, it becomes concrete because, that community knows who they are, what the issues are, what the challenges are, and they can on a real-time basis be able to identify what some of the solutions to ending their homelessness might be. Next slide, please. This is another community. This is more of a mid-sized community that we work with that's actually starting to identify how many all single adults are experiencing homelessness. So it's a much larger number, requires a bunch more lots more coordination across their system. But now they can identify how many all single adults are experiencing homelessness. So just give you a couple of examples. And they use this to understand trends and tracking and so forth. Next slide, please. So I just want to share kind of like the impact of this at a national level, potentially at a national level. On the left-hand side of this slide, you can see this is the results of the point in time count, right? The yearly point in time count that every community is required to do for chronic homelessness. Now, the point in time count has lots of value, right? It's a way to galvanize community. It's a way to like take that snapshot to understand what's happening right now in a community. And so it has the value. And that's what you see on the left-hand side is that there's 5 data points, right? Over time, that's chronic homeless count, seeing an increase over the last few years. On the right-hand side is an aggregation of all the data that communities use in Built for Zero. And you can actually go from 5 data points to probably 50 data points to be able to track and understand on a more real-time basis how many people are experiencing chronic homelessness, what are solutions and so forth. And, I think this just, again, speaks at maybe a national level or maybe at a state level to be able to understand on a more real-time basis how many people are experiencing homelessness can actually have a bigger impact than just being able to track it one time a month. So left-hand side is like that snapshot, right-hand side is like a video. Next slide. See the same things for veterans, right? So for veterans in the kind of the point in time count, 5 data points on the left, 50 on the right, right? It just makes using the data in this way makes things more actionable. Leaders in communities, local service providers, they can actually take action on the data and really understand what's driving, increases or decreases in homelessness. Next slide, please. So just want to include some, resources that are available online, linked here, including our website, some nice primers on what a by name list is, some videos and so forth. If you have questions, feel free to reach out to me. I'm always happy to have a chat.
Well, thank you so much for that, Adam. And I would be remiss if I did not also introduce Liz Hirsch. She is the Principal of Policy and Advocacy at Community Solutions. She's an absolute veteran of homelessness policy. So we're really fortunate to have her with us to help answer your questions too. I see some questions in the Q&A function. If you joined late, please know that we will have 15 minutes at the end for your questions. So please don't hesitate to drop them in there. And for the next quarter of an hour, we will turn it back to Adam to lead a conversation with Jodie and Mackenzie, our guests.
Great. Jodie, Mackenzie, thank you so much for joining the call today. Want to just share, Jodie and Mackenzie are from the Chattanooga community, Chattanooga, Tennessee, who has been in Built for Zero for some time. I think Chattanooga goes back many years, back to 2015 or 2016, I believe, and has been such a value. We've learned so much from the work happening there that helps influence how we approach the work at the national level. But I would love to, hear a little bit more, Jodie and Mackenzie. Could you tell us a little bit about Chattanooga as a community and tell us a little bit about the organization that you work for?
Absolutely. So Chattanooga is part of Tennessee 500. That is our continuum of care, and that is made up of 11 different counties. Chattanooga is in Hamilton County, which is more of an urban county. We also have one more suburban county, and the other 9 counties in our region are rural communities. So we need different strategies for different types of populations. It's a very scenic area. It's near the Appalachian Mountains, the Tennessee River Valley. So we have caves, caverns, forests, waterfalls. So it's a beautiful place with lots of good hiding places. And we also have a lot of small nonprofits and non-charitable organizations that are helping to reduce homelessness, but it's very decentralized because they're so scattered around. So that brings benefits and challenges as well. So, Mackenzie, do you want to talk about the Homeless Coalition?
Yeah. So our role as the lead agency of the 11 county region is, aside from being the collaborative applicant and the HMIS and coordinated entry lead, we have really over the past, I would say 5 years, really kind of focused on trying to centralize a lot of those services and make sure that that things are collaborative and that we're all kind of working together to reduce the duplication of services and ensure that everybody in our region is able to access services and able to get connected to housing resources. So our main focus, aside from kind of our roles as the lead agency, is to ensure that service providers are communicating with each other and are serving in a collaborative way.
And so you actually support more than Chattanooga City. It's across the whole 11 county area that includes some rural communities. And Jodie, I think it's just important to lift up. It requires different strategies. It's really community specific, even within that area. And when you think about some of the challenges that you're facing right now, what are some of the big ones that are coming up in your community in relation to homelessness?
I would say affordable housing is probably the biggest one. I know that that's not specific to our community, but we just don't have enough places to put people that are experiencing homelessness. I also think that we have a need for some more low barrier emergency shelter. Emergency shelter isn't the end solution to homelessness, but it's a safe place for us to start. Identifying resources for the rural counties is a little more difficult. We wish that we had Medicaid expansion. We have to kind of get creative with how we supply supportive services.
So a lot of resource needs, coordination needs, and I think you just touched on how so much of this is localized too, right? So you mentioned Medicaid expansion, that impacts Tennessee. Well, it may not impact another community. And that, I think the one thing that we've learned in our work is that so many of the challenges become local challenges, right? And require some of those solutions. So those are the affordable housing is something we hear across the board as impacting, from our largest cities to some rural communities as well, the affordable housing crisis. Could you tell us a little bit about, the journey that your organization has taken with doing the Built for Zero work over the last few years and having a more comprehensive data system? Can you share a little bit about that?
Absolutely. I think that our realization began when we realized that our by name list was not representative of who was actually experiencing homelessness in our community. Our by name list was cumbersome to update. It became kind of static and outdated very quickly. We are also using an assessment tool that wasn't meeting the needs of our specific community. We wanted an assessment tool that was more trauma informed, and we also wanted an assessment tool that would open up access to our clients. So one that wasn't, housed within our HMIS system, so other providers could use it. So our journey kind of began a little over a year ago. We created a brand new assessment tool that was web-based and mobile friendly, which greatly increased our access points. So now we were able to get that assessment tool into our schools, our hospitals, our health clinics, our libraries. It's mobile friendly, so our street outreach workers could use it. Our VA and domestic violence providers that were using different systems could now use the same tool. And we were able to create the tool to meet the privacy and security needs of all of our clients.
I just want to stop there for a second, though. So you're saying that in your community, you were able to overcome some of the data sharing challenges that we hear is very common, right? The data sharing and collaboration challenges. You mentioned libraries. Why libraries? Why is that coming up as a partner that you're working with?
We wanted our access points to be where people are experiencing homelessness, and libraries is the common one. We're actually able to have our librarians trained, but we also can station social work interns there, and they can just begin to build the relationships with those clients and get them quickly connected to resources.
So really a no wrong door approach then, or if if folks are going into the hospital or the library or wherever a school is experiencing homelessness in the school system, you develop a system and continue to develop a system where they don't get missed, they don't get lost. That's the idea of having comprehensive outreach. That's really great. That's really something.
And most of those places want to be able to help, and this gives them a tangible way to help. So.
Yeah. And I'm curious about the data, the data sharing. How did it take a while to get agreement and consensus among all the different agencies and partners?
Absolutely. Mackenzie may be able to comment on that, but each, different agency has different privacy and security needs. So it's really slowly building those relationships, getting their feedback. What is it that needed to change for them to be able to use our system? But it also goes back to that client's choice too. The client may choose to consent to our assessment tool, but not consent to this part of their data being shared. So we can kind of silo it off a little bit, but I don't know, Mackenzie,
that's really
add on that.
important. Yeah, that's great. Mackenzie, I'd love to hear what you're thinking.
Yeah, I think the biggest piece was the relationship building. I think that there's just this kind of general mistrust of other organizations. And it all started with building that trust and ensuring that we're using this data for a good purpose that is essentially going to move our community to the end goal. So a lot of it really was just relationship building from kind of the administrative level all the way down to the client facing level. And we kind of started slow, and I would say we're still having we're running into issues every day. Anytime we update anything, we have to go through a lot of different channels depending on our different organizations that we're working with. But now we kind of know which organizations are going to require what, and we've learned how to approach that. So just a quick example, we're making a couple of little updates to the way some things are going, and the way that they're gonna kind of the platform that things are going to be hosted on. And we have a homeless healthcare center, and that has been one of our kind of more challenging data sharing agreements there. And so in making these changes, one of our coworkers went to the healthcare center to talk to the staff there instead of just shooting an email over there. So it's still this constant kind of building of trust between the organizations to ensure that things are going to be kind of okay and accepted moving forward.
Yeah, and just the requirement to just continue to maintain those relationships. This is not an end state. It's always iterating, always improving, and always maintain those relationships. And so how, just curious in our last question, because I know we only have a couple minutes left. How are you using the data now? You like I said, you've been working with us. Your organization's been in Chattanooga as a community's been working with us for some time now. And I'm curious to see and hear how you're using data to understand need. Can you talk to us a little bit about that?
Sure. We're using that data that we collect to understand our local homelessness trends and to measure kind of the effectiveness of our existing strategies, but also using that data to adjust strategies and maybe allocate resources differently. I call myself kind of a data sleuth. I'm just naturally curious. So just digging into the data in lots of different ways. Maybe you see a very simple bar graph or line graph. What is that trend telling us? Or maybe doing some deeper statistics and finding your outliers. Why are they existing? Kind of back to some of the stuff you were sharing about Built for Zero, looking at our inflow and our outflow, who's missing in that data, comparing our data to other sources of data, comparing it to the census, who might we be underrepresenting or overrepresenting in our population. And then kind of just taking that and breaking it down, disaggregating it into different population types, subpopulations, household types, and developing person-centered strategies and solutions, and then coming up with best practices and lessons learned to kind of create those system-wide solutions for our system.
So it's constant, continuous improvement, reacting to the data to understand and digging deeper. And that's, that's the core of what we believe works, right? That, you have to be constantly looking at the data and understand what's happening. Mackenzie, I'd love to hear any other insights you would have from where, you sit in the organization.
Yeah, I mean, I think Jodie pretty much touched on all of it. I think big thing that she said is kind of seeing where we might not be reaching, seeing where our gaps in services are. 3 years ago, we realized that we had less than 1% of our data was showing Latino folks experiencing homelessness in our community, whereas almost 13% of our population here in Chattanooga identifies as Hispanic or Latino. So it was not that they were not experiencing homelessness,
Yeah.
it was that we were wildly underserving them and they were not finding access to the system. So we started partnering with different organizations that were serving that population. And now our data is showing much more kind of representative numbers to kind of, we are seeing that those folks are now able to access the system much easier. So I think that's just one example of ways that we're using our data to kind of pick out those gaps in our system.
That's great. Thank you, Mackenzie. Thank you for sharing. Well, I think we're over time now, Claudia.
Yes, and we have nearly 20 questions in the Q&A, far more than we're going to be able to address in the next 15 minutes. But thank you, everyone, for your great questions. And please continue to add them in because we'll be looking at them when this webinar is over, and we'll try to get back to as many of you as we can. So it looks like quite a number of the questions, Jodie and Mackenzie, are for you about how your by name data system is kind of linked or not linked with HMIS. And what implications that might have in terms of additional data entry burden or administrative burden. How do you deal with that?
So our by name list currently does not live in our HMIS system, but we are very close to making that happen. We had a vendor transition also this year, so there's been a lot of change. But we use the by name data to kind of feed some of that missing data that might have been lost in an assessment, but we also upload that assessment data into our HMIS system. So people can see who has been assessed, who hasn't been assessed, how long it's been, what their score might be. And we use some of the data from our HMIS system, like current living situation data, like where the client is currently sleeping at. We pull that data on a regular basis and feed it into our by name list, which lives in Excel currently, to kind of keep that list dynamic and up to date. So,
Right.
And the score is able to be changed based on as the client's data changes, which is a huge benefit because before the client would have to need to be completely reassessed. And now just as one data point changes, it can automatically update their score and reprioritize them on our list.
That's really helpful. And kind of a related question from Susan. She's asking, if you have large players who provide emergency shelter beds and day shelter with social workers who don't use HMIS, what do you do?
That's one of the reasons why we created our tool. Our tool is web-based, so it can be used on a tablet, a phone, it can be used anywhere, and we can go in and train those social workers or whoever they might be that aren't in HMIS. And then we have a data entry person that creates a project within our HMIS system for us.
Got it. This might be more a question for you, Adam and Liz. Jessica wants to know how communities are using the real-time data and maybe overlaying it with system or policy drivers. She says, for example, if an affordable housing complex is demolished or if there's a budget change that grows or restricts housing vouchers available, how do you maybe overlay that with the homelessness data?
Yeah, that's a great question. I'll take a stab at responding there. yeah, what I think we're hearing in communities when they actually have visibility into increases in inflow, for example, they actually can dig into the data to understand it better. You know, we work with one community that saw a big spike in inflow or saw consistent increases in inflow over time. Once they started digging into it, they were able to isolate that the inflow is actually being driven by evictions in 2 zip codes within their community. And it was actually predominantly impacting Black men. And so they were actually able to use that data to go to those local communities and try to influence local policy or influence the local municipal court system, you know, to try to reduce those eviction rates, right? That's just one example. But that's, you know, those are the types of things that we're hearing from communities and how they're using some of the data to dig deeper and isolate what are the factors. If there's a big rate of eviction in a certain part of the community, what can they do to help, you know, stem that or reduce those eviction rates? Liz, love to hear your thoughts too, kind of from a national perspective.
Yeah, no, I think that's a great example. And I think what Jodie and Mackenzie have said is really helpful. And I think the inflow and outflow data is just so critically important. What they found in one community, I'm going to go off camera because I have unstable internet, my apologies. What they found in one community.
We'll come back to Liz. Yeah. No worries.
I can share a locally specific situation.
Thank you.
Had a large hotel that very unexpectedly shut down, and we were able to take our brand new tool and assess nearly 100 families and quickly assess them and prioritize them. And we housed, I don't know, over 90% of those people in a very short amount of time. So we were able to use that data, you know, for a place that had closed down. It was great to see the community rally together to make that happen. So
great. Well, next is kind of a technical question, but maybe I'll layer something on top of it. So we have someone asking about how you visualize your data. And I think this is maybe both for you, Jodie and Adam, kind of how you turn your data into a visual storytelling tool. And then, you know, how do you use it maybe to convince policymakers to take action?
I'd love to hear Jodie or Mackenzie how you're using it locally, then I can bring it to the national.
Perfect.
sure, we use whatever tools we have available to us. So sometimes that is Excel, our HMIS system. You can also build some dashboards and those sorts of things right within the system. But we also use Tableau, Power BI, whatever tools are available to us and appropriate for the audience that we're presenting the information to.
And you know, I think the thing that we've learned in working with communities that it just depends. I mean, some communities use very impactful visualizations using Excel or Google Sheets. Others we know use Tableau and use very sophisticated storytelling, you know, visual storytelling using Tableau or Microsoft, you know, BI. You know, we know of one community that on the West Coast, so it was using visualization to really show the community the inflow issue, and they were able to show, like, for every person that's housed, they have 2 more coming into their system. And that actually helped influence, through that visual storytelling, helped influence kind of policy to understand what were the drivers for inflow. And so you know, looking at this visually is so important. There's some wonderful examples out there that communities have done to be able to really drive home the story of what's going on in their communities.
Great. Liz, I see you're back online. Do you want to finish your thought?
Sorry about that. No, I think everybody did a great job with that. Sorry for that. We're actually at a national meeting in LA, so you know, the internet is coming a long distance. No, all I was going to say, really, to reiterate on that was, you know, we found, like, by being able to look at, I think the power of this data in terms of, you know, obviously at the individual level and coordinating services, which is so powerful. You know, getting everybody around the table talking about who the people are, rather than the system having to having the systems be the center, it puts the person at the center. But we've seen, like, in one community where people were saying nothing is being done, nothing is happening. And it turned out when they looked at inflow and outflow that for every 10 people they were housing, 13 more were becoming homeless. And then when they actually drilled down in that, it turned out that local active military were driving some of the homelessness because they were simply absorbing the affordable housing and university students. Well, that means that other systems besides the homeless and housing systems really can help be a solution to the problem. And I think there was a question about what can private developers do. If you have this kind of data analysis where you can pinpoint the source of or the source of the homelessness and what the needs are, then that creates opportunities for strategic investments, sometimes by partners who might not otherwise come to the table.
Absolutely. Great. We have a question from someone in Los Angeles, actually, and I think this will be maybe a national question. He's wondering if these same kinds of data solutions work in big cities. Do you see differences between small and big places in terms of implementing?
Yeah, one thing we've seen in larger communities, in places like Denver, Colorado, is that the scope and scale of it's so much bigger when you look at it as totality. However, what we've learned in a place like Denver, and this is happening in other communities, when you start to actually break down by region, that's where, like in that community, they actually look at it every county or every municipality and work on understanding actively homeless counts, in those municipalities that then roll up instead of looking at it just at a big picture level. So what happens is it shrinks the change. It becomes kind of a local, even more localized initiative that then rolls up to the bigger community. And so we've seen this, that model really be effective in some of our larger communities where you just have to break it down into more manageable pieces to be able to see the impact.
Great. So Jodie and Mackenzie, this question from James, I'm also really interested in. He's curious if you've kind of linked with health systems to understand who's kind of having frequent contact with hospital emergency departments or even with jails. He says, I ask because interventions that are shown to reduce ER admissions and arrests might go a long way toward accessing more housing resources as well.
Yes, we ask those questions in our assessment tool as well, but we also partner with, we have a FUSE project, which is frequent use system utilization, I think, or engagement. And so that is a system that works with people that are experiencing chronic homelessness and are frequent users of the ER and might be in the jail or other systems within the community. So yes, we're able to help identify those through our assessment tool and make those referrals to FUSE. And we're, so yes, the answer is yes. Mackenzie, do you have any thoughts on that?
No, I think the partnership with the FUSE program has been great. I do think we have had a lot of kind of initiatives to continue to improve our relationships with our hospital systems. And I think that's kind of just slowly coming along. It has been one of the more difficult kind of data sharing areas, but we have made a lot of progress over the past few years, and I think that we'll continue to kind of work together to try to reach a point where we're actually kind of openly sharing data. But even as we sit right now, there is a lot of conversation and communication between our system and our hospital system. So even though we're not openly sharing data, we are having those conversations. We have folks from our hospital systems attending case conferencing meetings occasionally, things of that nature. So I think that's been really helpful as well.
Well, great. We are just about out of time. I'm going to ask one more question and we'll have to keep it short. But this is a very practitioner audience and someone would love to know a little bit about the cost of implementing this assessment and new approach. Do you have any details about that you could share?
Yeah, it's Jodie's salary. That's about Jodie and one of our other employees here at the coalition have pretty much built this thing from scratch. And so it truly has been relatively inexpensive cost-wise. Jodie, I don't know if you have anything else to add, but other than kind of the cost of the platform that we hosted on, which is extremely inexpensive in kind of the big scheme of things, it has not really cost much. It has taken a lot of time from Jodie and our colleague Stephen, but it has been pretty low cost to implement.
Well, great. Well, thank you all so much, Adam, Liz, Mackenzie, Jodie. It's been a real pleasure. I've learned a lot. I'm sure our audience has too. And we can't wait to post this so that people can continue to enjoy. All right.